RFK Jr. wants to decide if you should have a mammogram. This is America Dissected. I'm your host, Dr. Abdul
And I'm your co-host, Dr. Katelyn Jetelina.
and we're recording this on Wednesday, July 15th at 12 p.m. Eastern Time. Another week, another meeting canceled, it seems. Last week, RFK Jr. abruptly canceled a meeting of the United States Preventive Services Task Force. It's the group that typically meets in person 3 times a year to decide which preventive services should be covered for free under the ACA's requirement to fund preventive healthcare measures. I want you to just remember something, right? That preventive care is generally free because of the Affordable Care Act. And just a couple of examples here: mammograms, colonoscopies, annual checkups. And the 16 people who are part of this task force, they're all volunteers, and they've all been chosen by HHS secretaries. And last month, the Supreme Court issued a ruling that affirmed that Secretary Kennedy has the authority to remove members before their terms expire and to ignore their recommendations. Also last month, Kennedy fired every member of the other task force we've talked a lot about, the Advisory Committee on Immunization Practices. So naturally, Katelyn, we're all waiting to see if he's about to do the same exact thing to the Preventive Services Task Force. What do you think?
Yeah, I don't know. I'm concerned. This is clearly not just a scheduling hiccup, right? It's this clear pattern signaling something deeper. And it's the same pattern we've seen over the past 6 months, both with this administration as well as RFK himself. One is the topic, right? The reason they're doing this, it's basically, again, the war against DEI, right? The American Conservative publication called this out clear and simply that RFK and Trump administration have beef over the past few years because this task force has been focused on eliminating health inequities. They gave 2 examples. One is PrEP for HIV, and the audacity, the task force recommended it. So it has to be covered by insurance, even for more conservative companies, like the Christian, for example. Another example they gave was screening adolescents for anxiety, that the task force recommended that they pay close attention to adverse childhood events, which is more common among Black children. So we have this topic, right, that's shown a clear pattern against systematic racism and health inequities. But then also you have this pattern of RFK Jr. and this new HHS secretary leadership making unilateral decisions based on ideology. I think it's really important, just like ACIP, that this task force has been nonpartisan group. Members have 4 years. These terms are staggered on purpose, right? So it's not influenced by one presidential employee. So we don't keep getting this whiplash of what is covered, what is not covered. And I'm concerned. I do think he's going to replace all of the members, just like ACIP, and it's going to have massive implications. I think the next question I go in my head is, and Abdul, I'm really curious about your thoughts, is like, can anything be done? I think in theory, Congress could pass legislation that locks in coverage for some core preventative services, but there's just not been a lot of courage from Congress, and I don't see that happening. What do you think, Abdul?
There's a couple of things that I think are really important to recognize here. When the U.S. Preventive Services Task Force requires coverage, I want everybody to understand that saves money. Like in our healthcare system, you want people not to get sick, both because, most importantly, it's good for them not to get sick, because that's the whole point. But second, when they don't get sick, they don't require more care to cure or treat them once they've gotten sick. So this is about being able to prevent both illness in the public and cost on the healthcare system, which you would think is something that anybody thinking honestly about this should see as a slam dunk. That's what this is. So you want more things being covered. I mean, the idea of covering PrEP is about preventing people from getting HIV/AIDS. That's what PrEP does. And so the notion that somehow you don't want to have to pay for PrEP means that instead we would rather wait for somebody to get HIV and then have to treat them for HIV and have them have HIV for the rest of their lives. That is the trade-off here. And I just want to make that very deeply and profoundly clear for everyone who is paying attention. The other part of it that I think is so important to remember here is that this is also about an assault on the ACA. right? Folks don't like the fact that this was Barack Obama's ACA. They don't like the fact that there is government requiring certain things to get done and holding health insurers accountable. And y'all know what I think. I think we should have Medicare for all, literally wrote a whole book about it. But I also think that this is about trying to give insurance companies what they want and what they're lobbying for. And so, the absurdity of all this is that RFK Jr. is somebody who's talked about, quote unquote, making America healthy again. You would think that sustaining protections for preventive services should be an obvious part of that. But like, this is what gives away the goose, which is that when you're going after things like preventive services, it's quite obvious that your whole point about MAHA is about what's in opposition to what's been done rather than what is consistent with what you say you want to do. And I would love to see Congress act on this. I just worry that right now we don't have the Congress that is willing to do this. I don't know that they're going to be able to get the votes on it. And I think it's too easy for ideologically driven folks to lobby in on issues of, reproductive care or issues like PrEP to be able to can the whole thing.
Yeah, and I don't know if it's the fight that Republicans are going to hang their hat on, honestly, too. I'm curious though, Abdul, so RFK, it's clear what his agenda and his worldview is for about vaccines, for example. And I knew exactly what he was going to do with ACIP and what he's going to be doing with vaccine injury compensation plans, et cetera. What do you think he's going to do with this? I mean, I really don't know what his move is going to be.
I think to try and steelman his argument here, I think he genuinely believes that any intervention for health that is done by the healthcare system is bad, and that prevention is something individuals do for themselves. Now, you've well highlighted the fact that not every individual has the means to do this, right? And these kinds of choices are sometimes not based in an actual science, like the seed oil point, but also not everybody has the opportunity to, go and do these things that he thinks people should genuinely do for themselves. So I think he's just against the healthcare industry writ large. And what he's confusing is that even opponents to a lot of the greed inside the system, like me, recognize that the issue is not that the things that they do are bad. It's that they make those things too expensive and leave them out of hands of people who fundamentally need them. So I just think that his approach here is going to be able to say, well, real prevention is in beef tallow instead of seed oils, rather than making sure that folks have colonoscopies. And I don't know if I'll be right about that, but it seems to me that the best interpretation of his ideology is that he wants to take this back to, MAHA influencers to tell you what to do on Instagram.
Well, and it comes back to this theme that has come up with me a lot of times when I'm engaging, honestly, MAHA grassroots, is this conflation between big food and big insurance and big healthcare and what public health is and can provide and the power behind that. And not knowing, being able to dissect the difference or interest in that, or I don't know what is it's just incredibly dangerous. There's so much evidence to show how meaningful this task force is. And I know it's like, okay, fine, another advisory group of people saying what to do, but it really does. When we dropped the age of colonoscopies from 50 to 45, it jumped the number of screenings people got, not only because of the clinical recommendations, right? Because physicians listen to this task force for guidance, just like ACIP or something. They don't have time to go through this every single day. And then, like you said, insurance. Those are two big drivers of health behavior. And removing that, or I don't know. Well, I guess we'll see what happens. For now, It's just delayed meeting. But man, I'm having already PTSD from ASIP, and I don't trust this guy. I just don't.
Katelyn, I think this is the logical conclusion of they're lying to you. You know what I mean? Like, that really is what it comes down to, is like, they're lying to you. Like, who's lying to you about what? And we talk a little bit about this in the interview that that folks will hear a little bit later on in the conversation. But like, I wear a tracker, right? That tracks all of everything from my steps to my sleep. And I find that really valuable. I also recognize that it's way too expensive for a lot of people. but I'm also going to get a colonoscopy when it's time. Like those two things are not mutually exclusive. And I
Yeah.
think in the minds of a lot of Maha influencers, there's either this or there's that. And I think all of us would say there's both. And frankly, if I had to choose between my colonoscopy and my fitness tracker, I'm picking my colonoscopy, honestly. So like, we just have to recognize that there's like the foundation of the thing, and then there's the cherry on top. And like, if you want to make certain choices about food that may have implications on the very edges, that's great. Do that for you, right? Love that for you. But also, that does not mean then we should tear apart a lot of the scaffolding, right, that keeps a lot of people healthy in the forms of mammograms or in the forms of colonoscopies or in the forms of vaccines that are also that are critically important, if not more important than the edge case decisions that we sometimes make on the very, very edge of things. And then the last point I'll make is this. Look, if you really were serious about trying to address prevention at the fundamental level, right, then you would be going after Big Ag. And I haven't seen them do that, right? So, put your money where your mouth is if you're serious about it, but don't go, taking out the Preventive Services Task Force and tell me that this is something good for prevention. That's ridiculous.
Yeah, it is.
All right, let's move on. Last week, the Justice Department announced it had subpoenaed 20 doctors and clinics who provided gender-related treatments to minors. What do we know about this, Katelyn?
Yeah, so this is actually another topic coming in from the wake of Supreme Court rulings that all kind of hit us in June. So the Supreme Court ruling basically upheld state laws banning youth gender medicine across about half the country. And so this latest move around accessing trans medical records is, I first want to point out that this is an intimidation tactic, as well as, again, what we were seeing with the task force before, but following a pattern. The past couple months, this administration has really tried to find tactics to really target states that do allow pediatric gender treatments. So, for example, in May, children's hospitals received letters from Oz asking about the revenue from pediatric gender treatments, right? Financial pressure on hospitals. This followed June, where the FBI asked the public to report hospitals and doctors performing surgeries on minors. Then a DOJ is investigating manufacturers of drugs used to care for the violation of these drug marketing laws, the case that they're making. And now this, right, which is that they are going to basically try to access and subpoena these doctors and clinics' medical records. And we can get into the HIPAA violations on that. But basically, what I hope you're seeing is this pattern of basically going at this from every single angle. And now it's patient records. And to us in medicine and public health, and even as patients, this is a really big red line. And I think the next obvious question is, can HHS even do this legally?
So that's the interesting question here. I want folks to step back for a second, right? The administration has this approach in the way that they want to reshape society around a particular set of norms. They usually set precedents against politically unpopular targets that they can apply more broadly later on. All right. So you see them using immigration as a way of violating everything from due process to habeas corpus. What they're doing here is the federal government is potentially infringing on their own federal law in an effort to try and enforce state laws. So that doesn't make any sense. But I want folks to understand where this is going. Because while they're doing this on gender affirming care, which they know to be a politically easy target, do you know what this sets up for? This sets up for efforts to do the same thing when it comes to reproductive rights and abortion.
Yep.
And that is what I want folks to understand. If they can get away with doing this and subpoenaing, despite HIPAA, individual medical records on this issue, because very few people are going to stand up and have the political courage to say anything about it, they're going to set a precedent that they're going to apply in another setting, which is way, way bigger, which is when it comes to abortion. And so I just want folks to see that process happening. This is not normal behavior, right? The DOJ does not enforce state law. The DOJ enforces federal law, and there are not federal laws on the books here. And that's why I wanted to bring this up. For anybody who believes in the sanctity of medical records, everybody should be up in arms about this issue, because they're using this to set a precedent that means that they could come for you next. And I think it's just really important for us to be able to call that out and say and recognize that anybody's rights are everybody's rights when it comes to the sanctity and the privacy of your own medical records.
Courts are going to have to get involved, right, Abdul? Like there's no way.
I think that's right, but then we think about the Supreme Court case that just ruled on uh, nationwide injunctions from lower courts, right? And so
Yeah.
I think you're right. I think that individual patients or individual hospitals are going to have to sue. But that's the thing. Like, you may not even know that your patient records got subpoenaed because they're subpoenaing the hospital. And a lot of the hospitals might not be willing to actually stand up to the federal government because for them, they're at risk in a whole bunch of other ways. And so I do hope that there's going to be some effort, but anybody suing is going to have standing. And so this becomes a really naughty issue. And to be clear, right, like one of the through lines of Trump too is that they're a lot smarter and a lot more tactical about how they're going about this.
Yeah, absolutely execution. And the announcement didn't name any doctors or clinics. They also didn't constitute what transgender procedures are. So I guess we'll see where they take this, but $100, it's blue states.
Yeah. Yeah.
So let's pivot to another Biden era policy that is being rolled back, seems to be a theme over the past 7 months, is medical debt. Back in January, so before Biden left office, the Consumer Financial Protection Bureau issued a rule to remove medical debt from U.S. credit reports, which sounds amazing. That sounds great. It was challenged in court, though, and a federal judge in Texas reversed the decision. So if you have medical debt, it's going to stay on your credit report. Is that right, Abdul?
Yeah. So this is just to understand what this means. Credit reports are really critical because it's the individual report that decides whether or not you are quote unquote creditworthy. It decides the interest rate you'll get in a home loan or an auto loan. It is critical to being able to be and do in our economy. And let's just remember what medical debt is. These are people who got sick and decided to do the obvious thing when they got sick and they went and saw a doctor. And because of how broken our healthcare system is, they ended up with debt because they went to go see a doctor in the only high income country in the world that doesn't guarantee access to medical care without having to go into debt. Like, medical debt doesn't exist in other places. And so you have folks who have medical debt, 15 million of them, that shows up on their credit report. So it drags down their credit report and affects the rest of their financial health. And the idea here from the CFPB was that that credit reporting agencies should be blinded to your medical debt. It shouldn't go into that mix of things about whether or not you're credit worthy, because of course, medical debt is not like other kinds of debt. It's not like you made a profligate decision to buy a car you couldn't afford. This was, you got sick and you needed to get the care that you needed, and you went to the doctor or the hospital and you wound up in debt. And that's why this was an effort. Now, imagine trying to push that back, right? So that credit reporting agencies need to see that moment of weakness when you got sick and needed to get healthcare, which is exactly what the Trump administration did. Now, I want to put this in broader context, right? Because for the last several weeks, we've been talking about the big ugly bill and the ways that it's going to take away Medicaid coverage for millions of people across our country. Now, take these two things together. You lost your Medicaid, you got sick, you went to the emergency room, and now you get a bill. And rather than that bill, right, now being blinded to your credit report because you just didn't have health care in a time when it was life or death, that's going to show up on your credit report. So it's going to destroy your financial future moving forward. And it's hard, right? Because we always talk about the cruelty being the point, but it's hard not to see this as the federal government weaponizing against poor people and screwing them deeper and deeper and deeper. And so I just want folks to understand that, like, this is literally tightening the vice grip around poor folks when it comes to healthcare in our country. Katelyn, what do you make of it?
I mean, that's exactly where my head went. Was one, why the heck would you roll this back? I think this would be a hugely bipartisan support behind something like this. And then two is exactly what you said, the big, beautiful bill and 11 million people losing their Medicaid over the next 10 years. And us knowing that from a case example in Arkansas, that when you cut Medicaid due to the work requirements, people not only lose their health insurance, but this medical debt increased substantially. And like you said, it's just non-existent problem in other high income countries. It's exhausting. I don't know
It
how
is.
we get ourselves healthier and better in America by keeping these in place.
I highly recommend.
Do you have a book about this, Abdul?
Yes. And um, in other venues, I spend a lot of time thinking and talking about it. Let's just say that.
Yeah.
America Dissected is brought to you by Ground News. Let's chat about big tech for a second. Have you noticed they've flip-flopped their ideological stances lately? That shouldn't surprise us. These aren't democratic institutions or journalistic endeavors. They're big corporations who are more focused on shareholder value than any sort of public good. In these tools we use every day, like Google, X, TikTok, and Facebook, or Meta, we're not the customer, we're the product, being bought and sold to the highest advertising bidder and at the whim of their latest algorithm's decisions on what news I should be seeing. Thankfully, I found a news platform that doesn't use manipulative algorithms to send me down a rabbit hole. Instead, Ground News delivers diverse perspectives so I get the full story. Ground News is a platform that makes it easy to compare news sources, read between the lines of media bias, and break free from algorithms. Unlike the mainstream narrative coming from the news sources you're used to, Ground News puts you in a position to choose and compare the news you want to read while giving you a peek into what's being reported on opposite sides of the political spectrum. As we were prepping for our episode this morning, I wanted to read about the FDA's recent COVID vaccine decisions. Headlines in the center said, quote, FDA official restricted COVID vaccine approvals against advice of agency staff, whereas a right-leaning headline read, top FDA official rejects COVID-19 vaccines, citing unknown risks. It was helpful to understand how right-leaning media were trying to spin the decision by Dr. Prasad to overrule career scientists by highlighting, quote, unknown risks. With Ground News, you get details about the source of your information, including if the news outlet has a political bent, how reliable their reporting is, and who owns them, empowering you to compare how different news sources from around the world cover the same story. With over 9,500 five-star reviews of their app and website, Ground News is the #1 platform to discover how any news story is being covered, giving every perspective all in one place. Expand your view of the news, sign up for your Ground News account today, and get access to the mobile app, website, browser extension, and exclusive newsletters so you can have a well-rounded view of the world, think critically about what you read, and find common ground between perspectives. Go to groundnews.com/AD today to get 40% off the Ground News Vantage plan and get access to all of their news analysis features. That's groundnews.com/AD for 40% off the Ground News Vantage plan for a limited time only. groundnews.com/AD. There's another change coming down the pike. If you're on Medicare and you live in New Jersey, Ohio, Oklahoma, Texas, Arizona, or Washington, some of your medical treatments are no longer going to be automatically approved beginning in 2026. So the Centers for Medicare and Medicaid Services under the Trump administration are now going to require, quote unquote, prior authorization for 17 services that CMS says are, quote, vulnerable to fraud, waste, and abuse. They love to use that term. And I want folks to understand what prior auth means. It means that before your doctor can actually treat you or even sometimes run a diagnostic test, they have to ask your insurer if that insurer will pay, right? This is a tactic that private insurance has been using for a very, very long time to get out of having to treat folks for things that they think are too expensive or unnecessary. The idea that Medicare is going to start doing this, that to me is beyond the pale. Now, some of these services include things like incontinence control devices, impotence diagnosis and treatment, epidural steroid injections for pain, and 7 different nerve and brain stimulation treatments. And I just want folks to understand that this is going to mean that seniors are going to have to wait longer to get treated for things like incontinence because the federal government is worried about folks doing this in a fraudulent way. But I do want to offer a caveat here. There are situations where healthcare companies might take advantage of seniors, diagnose them for things that they may not need, and then sometimes offer over treatment. That's true. But prior auth may not be the way to go, especially considering the fact that more and more of it is being done by AI, which can tend to get the answer wrong. Katelyn, what's your thoughts on this?
Yeah, I mean, I guess that's where my head is at. I guess I'm already all clouded up with this big, beautiful bill stuff. But like most fraud comes from providers. Like you said, it's not committed by Medicare or even Medicaid recipients. And so will these prior auths stop that? For example, an ambulance company billing for fake runs. Like, that's not going to fix this fraudulent case here. Or, a pharmacy charging for unfilled prescriptions. Maybe it'll help with the exploiting of patients with unneeded treatments. We'll see, I guess. But I also want to reconcile this announcement with what Centers for Medicaid and Medicare announced. What was it, like a month or two ago, that they are actually going to be loosening prior authorization requirements because it is such a pain. And so I don't understand how this story is really making sense from the CMS perspective. And yeah, we'll see.
You're right, Katelyn, right? There was this sort of handshake deal with health insurers about the prior authorization process that HHS was pushing. And now they want to introduce prior auth for Medicare recipients.
Yeah.
Like the thing doesn't really quite jive. But to your point, right, we're watching the encroachment of AI into this process. Can you speak a little bit about the model that they're planning to use and some of the challenges that might come out of that?
Yeah, so CMS developed this thing called the WISER model, and it stands for Wasteful and Inappropriate Service Reduction. And it's basically what they're doing is asking prior authorization companies to apply to be part of this AI program. It's voluntary, it's going to run for 6 years through 2031. And basically using technologies like AI and machine learning to decrease certain wasteful or low value services that have shown little to no clinical evidence based benefit. It makes me nervous when they say evidence based under RFK Jr., but we'll just let that pass for now. And really integrated AI into this prior authorization review process. I think importantly, and I appreciated this, not all AI is just going to make decisions. They're still going to have clinicians to validate the determination. And look, we are in the new age of AI, and I think that we need to learn how to use it as a tool. And Lord knows government systems need to be upgraded and bureaucratic processes need to be streamlined. It makes me nervous, so I'll be honest, using AI so untested like this for people's lives, as well as for prior authorizations, right? It's already a nightmare for clinicians and patients to try to get their services covered. Now AI may make my healthcare decision instead of my physician. Doesn't really drive well for me. So I really hope that this is going to be used under a microscope, that we're really going to try to learn from this and build better systems for it. But we'll see.
I have one deep frustration about the way that AI gets sold to us and the way it ends up getting used. We're always told that AI is going to give us more stuff, right? And then it's always used to take stuff away. That's the problem that I have, right? The glorious AI future everybody likes to talk about is AlphaFold, right? Oh, look at this. It's created this program for us to understand how proteins fold, which unlocks all these opportunities for discoveries. I'm like, okay, show me the medication that it's discovered. But most of the time you hear it implemented, it's using AI to save some corporation or somebody a lot more money. And that's the worry about it. And we're talking about CMS and Medicare and Medicaid right now, but AI has been used for private insurance companies for a very long time. It is part of the challenge around getting the care that you thought you already paid for. And so I understand that AI could do a lot of amazing things. I just keep seeing it being used to take stuff away rather than give stuff to us. All right. So one last thing, and this is maybe our best attempt to end on a tiny shred of good news. Katelyn, we've got new COVID shots approved. Can you tell us a little bit about it?
Yeah, and I don't want to rain on your parade, Abdul, but I actually don't think it's good news. But you're right. So I guess the silver lining of good news. So back up. So if you guys all remember, what was it, 3-4 years ago, we were getting COVID-19 vaccines through the use of emergency authorizations, which means that we didn't have to get a license because it was an emergency. We needed to get these through fast, but with the understanding that these vaccines would eventually be licensed, and they have been for all adults. And now last week, we got the news that they have now licensed COVID vaccine shots for kids aged 6 months to 11 years old. And if it stopped there, that would be great. I would be like, okay, cool, business as usual. This is fine. The thing that makes me worried is that this vaccine, they licensed it to be only available to kids with at least one underlying medical condition. And the reason that worries me is a couple-fold. One is 50% of kids that end up in the hospital with COVID do not have an underlying condition. First of all, there's that big problem right there. But two, it makes me very concerned where they're going to be going with COVID vaccine licenses for this upcoming fall, 2025, 2026 formulation licenses. So this license that they just approved was for last year's fall formulation. Every year, the FDA, usually around August, gives another license for the upcoming fall season. And so the direction I see that them taking is, one, ignoring anything that's happening over at CDC or ACIP because nothing's happening over there. And two, actually changing the COVID licenses to a much narrow group of people. And so that's the direction. I mean, I think that's where they're going to be going this fall, is that COVID vaccines may only be licensed to people that have a high-risk condition or over the age of 65. What is a high-risk condition is not clear whatsoever. And whether providers are going to be willing to prescribe or give vaccines off-label and all of the liability that may come with it is also uncertain. So I don't know. I guess this is good news, but it also signals where I think that the FDA is going with COVID vaccines in the future.
Yeah, it's like something, but not enough. I don't
It's
love that
just a
phrase.
way. It's just what they're doing is just unilateral decision making. Like they're strongholding ACIP. I mean, they're going to be changing the licenses, and that has huge implications for who can get it and who's not. Even pharmacists can't give vaccines off label.
I think that's exactly right. It's like this is a way of offering it with a lot of caveats and provisos. And I think a lot of the danger is going to happen in the fine print. And
Yes.
what's going to happen is over time, fewer and fewer people are going to find themselves having access to these things because the traditional approaches that we take to giving them are going to be harder to both get and message. So you're going to have to like really go looking, which is a dangerous consequence because you want more people getting vaccines. I mean, it's like it is a crazy thing that we're living in a world right now where our federal government is trying to limit access to vaccines that have saved like millions of lives, and it is really it's preposterous and it's dangerous.
Yeah, I really am. I think uptake is going to be in the single digits this fall because there's going to be so much confusion. There's going to be, I mean, right now, physicians, it's mid-July, physicians have to put in vaccine orders right now for the upcoming fall. And physicians have no idea who's eligible. They take the financial risk if they buy the vaccines. FDA knows, RFK Jr. knows this. FDA knows this. They know exactly what they're doing. It's an indirect lever to reduce access to vaccines, and it's insanity. So not a positive note. Sorry, Abdul. But
No. Well, I tried. We tried,
we
Katelyn. We got to
tried.
give
Who did
people
you talk to
give
this
them
week,
something.
Abdul? Give us some good news.
Yeah, we had a great conversation with Dr. Mike Israetel. He is he has a PhD in exercise science, truly the expert in building muscle. And his fitness advice is based on evidence-based science, which, is extremely rare generally these days, and particularly rare in the spaces that he occupies, because his audience is really broad, includes a lot of the MAGA and MAHA types too. He's a really good communicator. He defends science in a field that's really full of conspiracies and pseudoscience. And our conversation was really wide reaching. It went well beyond fitness and bodybuilding toward thinking about how we talk about science. Now, you'll note he and I had a lot of disagreements. In fact, we went an extra 35 minutes long. And for folks who want to see the overtime, go ahead and go to YouTube. But we were able to respectfully disagree. And I actually think that's really important in our conversation these days because both of us came to the conversation in good faith and left with a better understanding of what we believed, even if we might not have changed each other's minds. And I just think part of the challenge, as you'll note in the conversation that we have in our discussion, is that sometimes there's an effort to just deplatform beliefs, ideas, and perspectives you don't agree with. And I just think we need to have more discussion. If you disagree, it's more important for those debates to be hashed out. And so you'll hear that in some of the overtime discussion. And I hope folks will stick around for that conversation. And Katelyn, thank you so much. Anything cooking this week?
Personally,
or professionally.
Or professionally. Oh, we're just trying to save the federal government. No,
No big
nothing.
deal.
No big deal. I actually just came back from Central Texas, the Guadalupe River,
Okay.
where all of that flooding just happened. So
Mm.
I'm happy to be home.
Yeah, we're glad to have you home and grateful that you went out there. All right, friend, we'll see you next week.
All right, see you next week.
All right, can you introduce yourself for the tape?
Yeah, my name is Mike Israetel, and I have a PhD in sport physiology, and I help to run RP Strength, the company, and the YouTube channel, and all that other good stuff.
Very good. We really appreciate you joining today. We want to have a conversation about the online origins of this MAHA movement that is shaping so much of our public health infrastructure now through RFK Jr. And I can think of nobody better to have that conversation with. You're sort of one of the heroes of the I'll say the bro fitness space. And even before I knew who you were like pervading my Instagram reels, started to watch your stuff and really enjoyed it. And as a scientist who also, admittedly not as intensely as you enjoys the fitness space, I really appreciated getting your videos. And my father, who's a PhD engineer, like literally loves your stuff. So I'm just grateful to share the conversation.
It's great to be on, man. Thank you so much.
So walk us through, how do you think about, like, as you're putting together content, how do you think about who your target audience is and where they're coming to your content from?
We think about who they are mostly by doing a combination of two things. One is to look at our analytics for YouTube, for example, which tells us a lot about who they are. It tells us gender breakdowns. It tells us extensively what their other interests are on YouTube, which can tell you a lot about someone. And then the other way we do it is to intellectualize, to draw some generalizations and inferences beyond the data that we have perceived, to try to reason through the world and figure out, okay, so here are the people we're talking to. Here are the total number of people that exist. What waypoint can we pick between those two in order to expand our reach, while at the same time still providing people an intersection of quality content that is still in a place where I can add some marginal value that makes sense? Because like we could do all kinds of crazy TikTok dance videos. I'm no good at that, so that wouldn't work. And we can sell out and do kind of crowd pleaser videos that violate the like scientific understanding of the world, and that wouldn't work. So anything that is like logically in my best estimate is correct, and also I think people find informative, entertaining, some combination of that, I think that's who we look at to be our target demographics. It's very broad, but we do have the data on who our target demographic already is, although it's growing and changing. And so we do have some understanding of who we're speaking to at any given time.
That's helpful to understand. And you come at this, you are as evidence-based as it gets in this space, which I deeply value. And oftentimes, unfortunately, this is a space that's not known for, we'll just say it's adherence to scientific evidence. And so I see you a lot of times in your content, both trying to offer evidence-based advice and also do this thing of educating people about how to think about science in the process. How purposive are you in trying to do that? I mean, how much does that shape your thinking about trying to give people some, to put it crudely, like a bullshit meter about how to think about what they're hearing in all the other videos that they're getting served when they get served yours?
Yeah, quite a bit. So science for us operates in two ways. One is a filter. We only say things that make reasonable sense scientifically, because they're more likely to be correct, and having correct advice, no matter where it came from, is a really good thing. The other one is as a toolbox that we slowly over time, mostly through kind of implicit skill sets, but also through explicit articulations of you need to think like this, in order to think more clearly, we end up sort of helping, especially long-term audience folks, build up their kind of baloney detector a little bit more, their scientific worldview a little bit more, so that instead of just consuming some decent info from us on the channel, they can go and see another fitness claim or a claim in something even just related to fitness, like health or longevity, and look at it and parse it through a scientific lens that they've built in many ways, but hopefully in some small part with our help, and then be more likely to make correct decisions and less likely to make incorrect decisions. So one place where we like people to be is a great place is that middle of the road where you're not so sure you want to say this thing is wrong, but you're not like, oh, this thing is for sure right. The for sure right stuff will come along one way or another at some point, but getting onto things that are for sure wrong is like a super, super bad idea. And so even if we can get people to be like, well, yeah, this stuff that this person's saying might be true, but it sure hits enough of the warning signs on my kind of scientific thinking ometer that I'm just going to put this aside for now and not invest heavily into the idea that this could be true. And I think even that is a huge win in of itself.
Yeah. No, I really appreciate that because that's the thing about science is that usually it doesn't have big exclamation points on the claims it makes. It usually offers you a, this is the best available evidence that we have right now. This could
Yeah.
change based on new available evidence. And it seems to me that the space is dominated by people who make claims that go something like this. If you're not doing X, Y, and Z, you're leaving huge gains on the table, and so you're failing at fitness. And
Yeah.
those claims tend to do really well. And I don't know if it's a matter of like the psychology of the kinds of folks who tend to be involved in the space. I don't know if it's the incentives of the algorithm that feeds that. I think it's probably some emergent combination of the two of them.
I can tell you
I,
right now, there's no algorithm other than a thing that tries to get to answer only one question. What do you, the viewer, want to see the most? That is the
yeah.
entire purpose of the algorithm, and it is a limit function that ends at giving you exactly what you want when you want it right in front of your eyes. It is completely objective. And so there
Yeah.
is absolutely no agenda with the algorithm. Everything you see on YouTube and its trends are to just give people more of what they want. So your first question really says it all. Your first hypothesis is everything.
Yeah. So what is it about all of us who want a firm answer? And because that's the thing about it, is like inevitably there's some new thing that surfaces, right? Like I think
Yeah.
that the issue of the day is sauna. I saw your quick short on sauna, right?
Yeah.
And there are people who literally are out there saying that like if you're not doing sauna, you are going to die a shorter, less, and you live a less happy life before you do it.
Yeah.
And people with credentials, right? And that's the hard part. Like people who have legitimate scientific credentials saying this stuff. And what happens is you end up having that, and then you end up having this sort of backlash community, right? That always comes up, and then you end up having these like two positions. And I guess what is it maybe about the psychology that leaves us wanting a level of certainty around this thing? That like we want to know that we side on one side of what is ultimately like not that important a debate, all said. Um,
Sure.
I mean, how do you think about that? Like in your sense of being a very successful creator in the space, like why do you think that that's so pervasive here?
I think the human desire for certainty is at its core completely logical and predictable. Um, Uncertainty is objectively worse than certainty if you have a choice. And so certainty always looks better because it is a much more high probability assessment of what to do. And so certainty is a thing like well fitting clothes, properly controlled air in your home, and good food. Everyone's for it. And so it's really easy for people to come in and say, I have certainty for you. Um, the real question is, do they have certainty? And the answer is usually not. But people still click on videos that are very certain because they want certainty. And sometimes
Mm-hmm.
they get it. Sometimes they get a little bit of it. Sometimes they get none of it at all. And then somewhere between it being clickbait and it being presented as certainty, even in good faith, but actually being substantially uncertain, is where the rest of that kind of variation lies. But people always want certainty anyway, and it's a good thing that they want certainty. The bad thing is that what is presented to them as certainty isn't always nearly as certain as the people presenting would like them to believe. And that's always going to come down to the filtering system, predominantly of the person clicking on videos.
Mm-hmm.
Some number of videos you can click on and get burned enough to where you just don't believe thumbnails and titles anymore. Or you realize some content creators make much more believable thumbnails and titles than other people. So when you see someone else's, you're like, this is probably dog shit because they lie all the time. And then you see someone else's, you're like, it was 9 times out of 10. This guy, when he's certain about something, it really is a lot of evidence for it. And so you just end up choosing people that you like. That doesn't mean everyone's good at making that selection. And there are way more factors other than the veracity of claims addressed that require you to select a fitness influencer. A lot of times it's vibe and comedy and what they look like and 50 other factors, but that sure is one of them. And over time, there has definitely been a trend in the fitness space, as far as I've seen it, where at least clickbait thumbnails, like you're going to see this in this video, but then you don't, they have run their course. They're very, very tough to sell, which is great, because enough people on YouTube have been like, I don't follow this person anymore because nothing they ever say makes any goddamn sense. The thumbnails always BS. So over time, it is changing slowly, but it is changing.
I think the other pervasive, uh, I want to call it a zeitgeist that you tend to have is they don't want you to know X. So
Sure.
that, it's the certainty about a thing that is new and novel that tends to counterpose, right, traditional science, or at least the scientific establishment, right?
Sure.
And what tends to perform really well in a lot of these spaces is when you're certain about that one thing that they don't want you to know. Who's they? I don't know. Like, why don't they want you to know it? I really don't know either. But like,
Got to click.
it's
Right.
right. It's like, and so they've got this like hidden gem of something. Over time, what tends to happen is you get enough of that content, and it tends to undermine belief in them, right? Whoever them is, and that
Yeah.
tends to be evidence-based science.
Yeah.
In your thinking, right? You've been really successful as someone who hews very closely to the evidence-based science, and you're honest about this kind of situations. You're like, well, if you like doing this workout, you could do it. Like, that's fine. There's nobody's
Yeah.
going to tell you not to. It just may not be as effective as this other one here.
Yeah.
How do you deal with a lot of that attempted to undermine evidence-based thinking, as if there is really just this cabal, this conspiracy of people who just don't want you to get big enough traps? Like, I can't make sense of it, but like maybe you could help me here.
Listen, Abdul, I'm going to assume from your name that you're not Jewish. And so you're clearly just not in the anti big trap cabal, which pays me lots of money regularly, sir, to keep people's traps small. Anyway, that's all in the fine print. I get the emails every week. Um, to us at our RP Strength YouTube, a lot of videos like that are actually a gold mine, because if the zeitgeist is this thing that people used to tell you is right is now wrong, and that's incorrect. It turns out the experts were right all along, and the new thing is a wild exaggeration or just wrong. We love that shit because we'll make a video of being like, the experts were right. And that is now because there's so many videos of they lied to you. When you say something like the experts are right, you're wrong, that blows up the internet. It's awesome because people are like, oh, that's different. And so to us at RP, it doesn't really much matter how people present this one way or another. Now, for the general consumption of the public, and assuming that the folks who consume social media health advice, we have like some interest in them getting marginally better advice than worse advice. There is a whole landscape I could chat about why some people prefer headlines like that and why they have a mistrust of expertise. That is a topic near and dear to my heart. But I'll say, like, the easiest explanatory factor requires zero invocation of politics. As soon as I tell you, you're going to be like, of course. That it just hits right. It just hits right. There's no depth to it at all. Like, to make a really absurd analogy here, it's like you're with, a girl you've been seeing a few times, and it's nothing serious yet, but, stuff's happening. And like super, super hot girl walks by, and you like stare, and you come back, and she catches you. She's like, so what's that? You're like, no, it's just a really hot girl. That doesn't make her special in the least. It's just human biology. Heads just do this. That's what they do. Don't overinvest into it. It's just a true fact. Like, I don't know her. She's probably awful. I don't ever want to see her again. But the same thing with like thumbnails and titles that are like, the thing you thought is a dependable base of knowledge you take to work every day. Wrong. And people just love that because they're, well, I don't want to be wrong. And it's exciting. And that's really, like, for most people, that's really the only reason. Now, there is a subsector of people who overlap with that sector, who actually have like a little bit of a mistrust of expertise, and a belief in the they. And those people definitely are hook, line, and sinker for all that stuff. They're a much smaller community than the overall, like, just curious dude who's like, wow, people are wrong about this, I want to know. That's like 80% of it. But there's a 20% where it's like, yeah, there's a very, very distinct, especially in the Maha circles, a kind of a backlash away from expertise. That's its own very interesting curiosity.
And my worry is that over time, that sort of penchant that we all have built in our minds to not want to miss out on that one tidbit of information, not want to be wrong. I feel like if you get fed videos over and over and over on that, what tends to happen is it starts to create a worldview in which you start to think, well, experts are always wrong. And the worry I have is that you step back and you take a 30,000 foot view. We've had this rise of an anti-science movement, a lot of it seeded on the internet, a lot of it seeded in a lot of these algorithms that you and I live on. And the worry that I have is that now you actually have a guy who is the Secretary of Health and Human Services who comes out of that space, who's in a position to make a lot of really important decisions when it comes to our public health policies. They're, taking fluoride out of the water. They're, second guessing the value of measles vaccines. And I want to ask you, what does it look like to try and push back on that? Like, as you and I are both kind of, by virtue of having done doctorates in this stuff, members of the They Club, right? Like, what are the kinds of things that we ought to be doing to be able to push back on what is this emergent tendency over time as a function of a lot of this conversation that's been driven?
Yeah. From our perspective on the RP channel, what we want to do is attend to two things at the same time. One is that experts are very fallible and have been wrong numerically often, statistically rarely, but there's a lot of stuff experts say. So you're going to have dozens and dozens of things experts are totally wrong about, even though there's thousands and thousands they were just completely correct about. We have to recognize that experts have a fallibility, so their word cannot be used with some kind of deified authority. Like they're just like, you can't, the experts say, So you have to have a justification for expertise, a room that they could be wrong, and a very fruitful conversation among all parties. At the same time, we have to assert, because it's logically true, at RP, that experts tend to be correct a lot, and so expertise carries a lot of weight. Joe off the street and then Mr. Expert at academia both have every single identical civil right to express any opinion they want. But in the expert area that we're discussing, assuming the academic is an expert area, the probability at face value that the academic is correct versus Joe off the street is like 2 orders of magnitude higher. And so if you are a curious person who wants to improve their fitness or just learn more about the world, you're going to want to listen to a lot of experts, and you're going to want to listen to the occasional video of the experts who are wrong. But that video is probably better presented by somebody like Menno Henselmans, who is an expert and an iconoclast, rather than who someone's not an expert at all, isn't an iconoclast. Because it's always fun when some sort of, maha-pilled, pseudo right-wing manosphere podcaster guy who's out of shape says, well, the expert's wrong about this health thing. It's like, and you would know about this how exactly? And obviously this person absolutely could know about it and has a high probability of being correct too, and should be speaking truth to power. But the at face value probability he's correct versus the experts is low. And we try to communicate that RP, like, look, you're going to make your own choice. God bless you. We're going to tell you what the expert consensus looks like. We're going to tell you about some interesting stuff where the experts could be wrong about, and then you're going to make your own decision. 9 times out of 10, you just go, yeah, look, the experts have this figured out. 1 time out of 10, you're like, now this is interesting. And 1 time out of that fraction, so 1/10 of the time, 1 out of 100 times, the experts will be wrong, and thank God somebody spoke up.
Mm-hmm. Mm-hmm. I really value that perspective. That point that you made about numerically often, but statistically rarely. I think that's where we tend to get in trouble, right? Because there's a lot of grist for people to point to and say, here's why you're wrong. And you're like, yes, that is true. And there are a number of points at which you're wrong. The interesting point that you make, and that, we sort of started this conversation on, which is that science may not be right today, but the thing about it is it's self-correcting, like by its nature. That's like what science does, is that if you have an alternative hypothesis to what the quote unquote experts say, then that hypothesis will be rigorously tested. And if it's proven to be better than what was the alternative, or at least the null, then we will accept that hypothesis, and that becomes what the experts say. And what's interesting about it is that, it's like there is a fallacy at the heart of all of this. And, when I talk to other scientists about communicating science, the point that I always try to remind them is that to most people, the model that they have for expertise is like a priest interpreting the Bible. The Bible never changes. The priest has a different take, and you are an expert because you've read the Bible many, 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 many times. And so that's just that. Versus as scientists, we don't think of ourselves as priests interpreting the Bible. We think of ourselves as generally curious askers of questions to which we use a very rigorous process to answer and then update our thinking from there, right? But the hard part is this, is that you have this right, which is to say, you acknowledge the possibility for things to be wrong, but too often scientists, particularly scientists in government positions like I used to occupy, particularly scientists who have some imprimatur and are making public guidance, too often the guidance that we give them is you need to speak with confidence because there's so much confidence on the other side. And you create what is ultimately this paradox of how should you communicate like a level of certainty in the process, not necessarily in the possibility of the outcome. And you do this really well. And what would your guidance be to, like, you know, Joe Schmo health commissioner out in you name the city who's trying to explain to people why taking a measles vaccine right now makes a lot of sense?
Yeah, totally. It's really easy. You just have to say probably about two things. One is, nothing is certain, and you can really play with people because if they say there are certain things, you can always inject skepticism and make them realize it's not certain whatsoever. And then you say, but this is very much our best guess. It is very likely to be true. And as soon as you say those two things, anything you say afterwards has to follow those two things. And then anyone who critiques you for that being wrong, be like, yep, remember when I said I wasn't certain? Okay. Remember when I said was probably right? Well, here's my record on the last 100 science things I said. I was wrong on 2 of them. I was right on 98. So unless you have someone better than 98% correct, which is an A+ on every test at school, feel free to continue to follow my advice. And so some people who really don't trust experts kind of on a vengeful or ideological basis, a lot of times they'll try to put it, to where the experts have been wrong a lot. And then I think it's up to experts and consensuses and various bodies of government to go like, we have a track record. So for example, something I don't see very often is a industrial size hammer for a pin nail approach of vaccine efficacy. I think the number of media that can be made by people interviewing virologists and toxicologists and them themselves making media that says vaccines are like one of the greatest things we've ever invented, and the benefit to harm ratio on average is in the 1,000 to 1 to a million to 1 trade-off ROI. We have almost no other biological thing, including healthy eating, and any other activity you could ever measure that most of these don't even come close to the vaccine trade-off. And so if you have a problem with vaccines that requires you to stop taking vaccines, you should stop dependably doing things you usually do. You should run around naked in thunderstorms. You should put raw meat on yourself and go swimming with shark-infested waters. All kinds of things become like, well, it's roughly as safe as not taking a vaccine. And so I think it really needs to be put to people how one-sided the debate really is, while at the same time, very open-mindedly accepting their problems with vaccine science and addressing every single claim. Dr. Mike Warshawski, the real Dr. Mike, had a great thing where he sat down with a bunch of vaccine and autism folks and it just debated them one-on-one. I think that kind of content is awesome. So I think that content producers on the pro-science side shouldn't be shy. Another thing is there was, some other media I've seen recently about someone who's a real nutritionist trying to, talk about what real nutrition looks like versus, bombastic claims by health influencers. And this real nutritionist, I won't say who he is, I think it was a great podcast of his I saw, is a very nice fellow and did a great job, except made almost no affirming claims that were high probability to be correct and thus stated concomitantly confidently. And thus I could have walked away with it if I didn't already know everything he was saying, which is my job to know. So I'm not the target demographic for that. I would have walked away from that podcast being like, this is a person who's very unsure and has functionally almost no advice to give us. And if you have no advice to give me, but the health influencer does, at least the health influencer has something for me. If I go to every restaurant and you say, don't eat there, don't eat there, don't eat there, and I turn to you and I go, where do I need to eat? You're like, well, I don't run a restaurant. I have no idea. I'm going to consider you substantially less helpful than otherwise. So I think when the evidence is very strong, we should couch it like that, say we could be wrong, say this is still our best, and then really pour down people's throats what that evidence really looks like and how clownish it can be to completely ignore that evidence or to go on a way tangent to other stuff that you are supporting that's very anti-evidence, but you have a lot of feelings about. And having a lot of feelings about stuff can be exposed by evidence-based people to not be a dependable way to reach good conclusions. So I think we can really be, as scientific thinkers, still probabilistic, still giving our best guess instead of certainties, but also giving our best guess with confidence of a best guess. Like if you have to get to the beach versus the woods to get rescued by the helicopter and you and your friends are stranded and you see the beach and someone's like, we should go this way to the woods. You're like, I have a high probability estimate that the beach is right there because it's fucking right there. Look at it. And I could be wrong. It could be a mirage. I could be insane, but it's not like, well, I love your forest idea, and technically we could both be correct. Like, there's no time for that. But when we're in a survival situation, high probability estimates are good enough to really pour a lot of resources into. And when you're asking whether or not your child should be vaccinated, that is like, that level of importance, survival level of importance. You should probably be, as a scientist, okay with being like, yeah, vaccines are goaded. They are undefeated. Everything has downsides. Their downsides are tiny and mostly misunderstood. Their upsides are, and you just start a slideshow of fucking polio, bro. Start the polio slideshow. Just hammered it. People want to use emotion with moms who have lost children, unfortunately, to what they assume are vaccine side effects. Sometimes they really are. You roll out the emotion stuff on our side. We don't need to be playing this game where we're always just monks and everyone else gets to use the full spectrum of hue and appeal. Roll out the smallpox shit, the crazy images of kids. A lot of times social media doesn't even let you show that shit. And you should be showing that because it's, guys, nobody is playing. You do not want to see your kid with smallpox. Sure shit don't want to see him with measles. This is what it looks like. You see this person who can't breathe anymore is 4 years old. That person's dying and their parents are struggling and they're weeping and there's nothing to do about it because they missed the boat on the vaccine. That kind of stuff we need to say more often because that's the real shit. These people dying of measles and everything, they're not statistical aberrations. They're real human beings. Right. We hear about every single person who people want to speak up about vaccines and autism. Every single has a human face to them. This is my son, Jake, he's 11. He has autism because of a vaccine. Dope. That may very well be true. It's not. But it might, hey, listen, we're open-minded to it. But here are these other people who got screwed with vaccines. The real big problem is in the United States, we haven't had any evidence for the other side in a long time because we more or less kiboshed entire categories of diseases with proper community-based vaccination, by the way. So we just got to go to pictures of Pakistan and Africa and crazy-ass places, no offense, where like the vaccine still hasn't spread and there are people dying of diseases you never, ever want to see in your life. So we need more emotion dumped in with the expertise.
Yeah, I really appreciate that point. I think you're right. There's a sort of sense of, you have to keep a monk-like ability to stay above the foray. I think one of the challenges now is like we have failed to do exactly what you're sharing for so long that now you got a guy who has been captain of the Maha team, who has the most powerful position in all of public health in America, who's leveraging it in ways to continue to push the mis and disinformation. You spend a lot of time talking to folks who would be open to a lot of what he is pushing. And the thing about him is, we've talked about on this podcast so many times, is he often points to the right problems. He just has insane solutions because he's not girded to science to actually address them. How do you push back, or where do you think the conversation needs to go? Because the hard part about this is, you don't explicitly want to be political all the time. And at the same time, any effort to push back on what's happening, let's just say in this piece of this administration, will always be politicized. And so it puts us in a bit of a quandary. How do you think about RFK in this moment as somebody who is, has fealty to the science? And how do you recommend we talk about him in spaces where there is openness to what he's trying to push?
I think much of what you said applies. RFK seems to me like a person who's just really trying to do a good job to make America healthier, which I think we all agree with. And so I think it's awesome. And he has a lot of problems with all sorts of things that he thinks are causing bad health. Some of them really are. Some of them are not, or of a tiny, tiny fraction of the problem. And so we need to look at RFK and his Maha people not as outsiders, but as teammates on Team America and Team World and Team Humanity, and be like, hey, fellas, like, we're not like, it's not him and his people, and we're looking from a third perspective. We walk over to his people and look at him from their ranks. Be like, oh, it's RFK. Cool. All right. What's he saying? Oh, he's saying all this good stuff, like dope. A lot of it's really great. And his why he's saying it is amazing. He just wants all of us to be healthy. What a great person. And so like, let's take a look at like, maybe what he's saying is actually like legit, seemingly according to science. And what he's saying is maybe not so legit, because I think all those people pretty much understand that like politicians can be wrong and often are egregiously wrong. So they'll never survive the critique of like, so you just like buy everything politicians say? They're like, well, hell no, I'm super skeptical. And they're like, but RFK is different. You're like, dope. He is pretty different. He's really cool. But let's take a look at all his claims and see if we can do any better, and see how like, what he says passes muster for like expert consensus and just like real world understanding just real world gut check, because a lot of what he says, gut check never passes, expert never passes. And people just kind of like, not everyone's an infinite knowledge. No one's an infinite knowledge machine. And so when he says various things, because he has good intentions and because they sound correct, they're like, yeah, sounds great to me. And where in fact, like, of course he has good intentions, but some of the stuff he says is just not true remotely, or is very, very far from the truth. Then it's up to us to very good naturedly say, hey, listen, I think this is wrong, but I love what he's trying to do, and let's discuss and see what actually happens in order to get the best path to the truth going without getting needlessly antagonistic and politically polarizing. Because the opposite end of the aisle on the left wing are some moderate fraction of why we're in a giant mistrust of science phase. They don't accept full responsibility for it. That would be crazy. But they do have a lot of problems that they made that gave birth to this administration and the way it's conducting itself in scientific matters. So I'd speak about that if you like, but that's not gonna.
I'd love to hear your take on that, please.
Yeah, super. So to me, there's like definitely a very complex landscape about why people don't want to hear from the trust the science crowd and from experts. The maha, I don't want to hear from experts. I want to hear from good natured Americans, people. It's super complex, but I think there are three major factors at play. One factor is that some of these folks are just like, their ideas don't match what science actually says. Like, they already have an idea that they're very attached to emotionally, that junk food is like really bad for your health in any dose, like it's a poison. And when you tell them, like, actually in moderation, junk food's totally fine, it's a little harmful, but it's teeny, and there's other variables that are way bigger, they just don't want to hear it. It has nothing to do with politics, has nothing to do with prior administrations, nothing to do with left or right wing. They're just full send, like, I want to believe this, and you tell them, this is probably not true, and they're like, nah, go to hell. And most of the experts are like, well, actually, yeah, it's not really true. They'll go to whoever who's not an expert to just agree with them. That's huge. That's probably the biggest one. Another one, a lot of people on both sides of the political aisle are just like not so into science and scientific and critical thinking, as true critical thinking is really annoying and doesn't really fit a lot of humans. Like, the hat doesn't fit that well. It can fit, but people just don't like putting it on. And so a lot of times when you're just not big into science to begin with, then people say, like, what about the experts? Well, the experts are only valuable if you consider expertise valuable, like epistemologically. If you don't, it just doesn't matter. And then it's just goes back to like, well, just like listen to everyone evenly. And there's just a whole lot more non-expert podcasters than there are expert podcast guests. And also almost everyone has ideas to begin with that might not match science, and then they just go to do that. So I think that's a big part of the puzzle. And the last one is like, there is a little bit of politically motivated, politically caused expert distrust. And that's because for a long time, academia was, it still is, heavily left-wing biased in the way that is not objectively defensible on many issues. And what we got from the trust the experts consensus, quote unquote, was some combination of absolutely true scientific things, some combination of that, and I would say two other categories. One is things that the experts want you to believe are much more clear than they are, and in fact, they're really not. And the other one is things that are objectively false on every analysis you could ever run that was logical, but people are in the expert class are trying to tell us really are a thing. And I think that one really burned a lot of people out on expertise. A lot of that happened during COVID and stuff like that. So like, I mean, I literally remember when Trump rallies would get major publications about them during COVID because it was a hyperspreader event, which it probably was. And then at the same time, BLM rallies got like, people said, because we had COVID and then the BLM thing started, the George Floyd stuff, and literal public health officials, major journal editors, like all the Twitter sphere, were like, nope, I support this cause. This is a great cause. People should be getting together to fight systemic racism, because systemic racism is even more dangerous than COVID. I mean, that whole thing I just said was just a giant pack of the most well-intentioned white guilt lies anyone's ever heard in their entire life. All of it was just batshit wrong, start to finish. And so if the expert class is like super like left-wingers, you can do no wrong. They look at right-wingers like, you guys are crazy and you're killing grandma because you're bringing COVID back in from your stupid Trump rally. It's going to catch a lot of right-wingers really, really wrong. And then when later you're like, hey, man, we all survived COVID. George Floyd shit died down. Everyone's cool. Do you guys want to listen to our advice on nutrition? They're like, fuck no, hell no. You guys lied to us in a big way. Another really quick one is the health at every size situation. Still to this day, the American Medical Association, I know lots of doctors, I see their recurring continuing education stuff. They don't talk about calories, Abdul. They don't talk about body sizes. And when they do, they say calories are not a focus of dieting. Everyone's healthy at every body size. Never bring up weight with your patient. It's stigmatizing. They want health at every size because it makes Karens feel better about themselves. Straight up, there's just no other reason. And so politically, it's such a massive force that's burrowed its way through almost every formal health organization, like all the public health sector, the American Medical Association, and everything down the line. When you tell people that, like, well, like, honestly, like, you can be of any size and it doesn't matter and you can be healthy, but like there's something especially toxic about like white heteronormative masculinity, like, there you go. Like, you made the Maha people the enemy. You told them the alternative was that every fat person is just as healthy as every not fat person, and that the real problems with health are like something like structural or systemic inequity, which is all make believe to begin with. And then like they just won't believe you because you've been wrong in two enormously major ways, and wrong in such a way that is obviously politically motivated. So then when you talk to them about vaccines, for which there is no political motivation, for which there is unanimous scientific one-way evidence that is like these things are like the god tier thing you should be taking and they're almost never to be avoided. But now you're coming from this perspective where at least about two major things in the last 5 years, you told them some shit that wasn't remotely true. And then, obviously the global warming stuff didn't help. I can talk about that at length if you like, but because academia has been so left-wing for so long, it started out in like left-wing in the best sense of the word. And then it slowly went over to where the extremists took over, and it was left-wing to the point of we're saying stuff that's objectively wrong. But if you say anything about it, you get like deplatformed. Like, we just recovered from the deplatforming wave in like 2021 or something like that. So now the Maha people feel really emboldened to like, rage against the machine, like speak truth to power, because for so long the power was the extreme left, and the kind of ideas that were told by quote unquote experts were just like blatant lies that everyone knew from their daily life was a blatant lie. And now you're trying to tell them, hey, but the vaccine stuff we were correct about. It's a tough road to sell expertise back to people to whom you use the expert class to lie to for political aims. Very good intentioned political aims, I might add, but nonetheless.
So I hear you on the point of there is a real and profound consequence to failing to show your work when you sieve down extremely complicated and complex questions into a right-wrong framework. And I think that, it kind of goes back to an earlier point that we were talking about, which is, a lot of times people from, public health officialdom or official public health feel the need to say this right, done, without saying, okay, I fully buy the possibility that we could be wrong on these things. And this is what that would look like, but here's where we are, here's what we know. And by the way, we've been right most of the time. I think, as you think about sort of the contraposition between George Floyd, for example, or MAGA rallies, functionally you have people who are coming together, and functionally the purpose for which they're coming together was either frowned upon or applauded by a lot of the majority of folks with platforms on in the spaces that most people would occupy. And I think, what should have been said is, hey, look, there is still real risk whenever you have large groups of people coming together, whether they're coming together at a Trump rally or they're coming together for a mass protest. There's probably less risk if they're outside. So if the Trump rally is outside and the protest is outside, okay. But also systemic racism is a real thing, right? People feeling or being treated differently by government is a thing. And we need to address that when and if it shows up, in which case there is a public health value to this that is broader than the specific consequence of the virus. But I think you're right in the point that needs to be fully said, right? And I think when you tell people, oh, well, actually this is okay and this is not, when people are looking at them saying like, but they're functionally the same thing, I get 100% where you're coming from. So I guess my follow-up on that, because I think you've raised some really good points, is, do you feel like being able to step back and say, here's where the work wasn't shown and here's where it ought to have been shown? And yes, like, it is very difficult to disentangle, the collective goal of all of us being healthier from the collective goal of us having less racism in society. And we should have talked about that more explicitly. Do you think there's value in doing that, or because it feels like the news cycle just moves on and we go forward?
Talking about racism objectively is probably a non-starter in the foreseeable future for American politics. Simply because objective discussions of racism brush up into things that are out of Overton window for both political parties. So
I agree with that.
racism is probably best treated as like a, hey, we all want good things for everyone. We all want equality and shit like that. Let's get to work on making that happen without going too far down the rabbit hole of cause and effect, blame, things like that.
Hey friends, my conversation with Dr. Mike continued for 30 more minutes. We've posted the rest of it on America Dissected's YouTube channel. I hope you dig in because you'll hear two people disagree in good faith. And in the times we're living in, I think it's important to feature thoughtful, respectful disagreement rather than pretend it doesn't exist. And a big thanks to Dr. Mike for a spirited debate and some fantastic training tips. That's it for today. You can find more content at our website, incisionmedia.co. Check out our shop at store.americadissected.com for our new America Dissected merch, including logo shirts, hoodies, and mugs. And don't miss our Vaccines Matter, Science Works t-shirts. If you have guest recommendations for the show, send us an email at info@incisionmedia.co. You can follow or subscribe to America Dissected on your favorite podcast platform and on YouTube at America Dissected. You can follow me on Instagram, TikTok, and Twitter at Abdul no dash. You can make sure to subscribe to Katelyn's newsletter, Your Local Epidemiologist, which breaks down the latest scientific evidence for over 300,000 readers. Search for Your Local Epidemiologist on Substack. Links to all our sponsors are available in the show notes. I really do hope you'll check them out and show them some love. They make the show possible every week. Finally, on our way out, don't forget to leave us a 5-star review. And if you're watching on YouTube, drop us a like or comment. And word of mouth still goes a long way too. So if you know someone who might like to keep up with everything that's happening in the world of health, please do let them know. America Dissected is a product of Incision Media. Our co-host is Dr. Katelyn Jetelina. Our producer is Andy Gardner-Bernstein. Video and audio editing by Nadine Melkonian. Our theme song is by Taka Suzawa and Alex Rubiera. Sales and marketing by Joel Fowler and Nick Freeman at Big Little Media. Our executive producers are Tara Knight and me, Dr. Abdul your host. Thanks for listening. This show is for general information and entertainment purposes only. It's not intended to provide specific healthcare or medical advice and should not be construed as providing healthcare or medical advice. Please consult your own physician with any questions related to your own health.